But across the board, this just pushes back to for why chiropractors should be addressing functional movement, corrective exercise in office. Hey everyone, Dr. Todd from Gonstead Spine and Wellness. In this video, we're gonna talk about when you should see a physical therapist and when you shouldn't. All right, so before we get started, make sure you subscribe to our channel, like, share, comment, do all that stuff. Realize we serve two audiences. One is our awesome public that we love and we care about, and we want you to live a life of abundance and certainty and confidence and controlling health in your own hands. How cool is that? So if you want to come in as a patient, we're here in Meridian, Idaho. Check it out. Our phone number is below. We also serve the chiropractic community. We teach chiropractors how to put functional movement, corrective exercise into their chiropractic practice. And the topic we're going to talk about today is a question that patients have, but also chiropractors have. Maybe even physical therapists have this question, I don't know. But I'm going to explain the differences between how we do rehab in a MoveNow clinic, in our clinic, versus going to a physical therapist. And I think what the role of a PT is, because there absolutely is a role in the healthcare paradigm. For those of you out there watching this, if you're family members of physical therapists or if you're a PT, truth be told, our good friend, Anabolic Andrew, who used to work at the clinic, just graduated physical therapy school. He's even helping us with video editing. So he's editing this video right now. So Andrew, I'll make sure I'm nice. I love you. So now let's talk about this. And this is the world according to me. So mind you, you can totally disagree. You can tell me where I'm wrong, comment below, let me know. This is the way I've seen it. This is my understanding. I think this is pretty accurate. Now, what is functional movement? So functional movement is restoring movement patterns. There are technically 7 human movement patterns. If you look at the functional movement systems, as far as how they talk about this, there's 8 different dysfunctions that we flag inside of our program, meaning we look at cervical, thoracic, shoulder, we look at scapular, and then we look at core, posterior chain, hip, and squat. Those are all the patterns that we screen, we look for, and then we put correctives in place to fix them. So let's say someone can't squat. They can't get from point A to point B the correct way, right? So if someone can't do a squat properly, we then have to break it down to figure out what dysfunction is causing them not to squat. And there's 3 reasons why someone can't move well. It's either joint, muscle, or brain. It's always one of those 3. When I say always, I mean probably 99.99% of the time, because there's got to be some exception out there. But joint, muscle, and brain is why someone can't move well, why they can't get from point A to point B, like why they can't even get there, or why they can't get there without some kind of compensation, or why they can't get there without pain. Squat is a basic human movement pattern. It's a great example for this. Let's say someone can't do a squat. We have to break down why they can't get there, and then we have to fix it. And so as a chiropractor and doing functional movement with chiropractic, like the stuff that we teach to chiropractors in MoveNow, we look at the segment, so segments of the spine and extremity, which is kind of like joint, right? Segment. We look at the posture. We look at how everything's aligned together. So how is someone's spinal posture first and foremost, because we know that the spine dictates not just mechanically, but neurologically movement and function of the extremity joints, the extremities being shoulder, elbow, wrist, hip, knee, ankle. Okay, so we look at the spine first, we clear the spine first, we improve spinal biomechanics first before we ever look at it. Well, I shouldn't say before we ever look at anything else, but I should say we do this before we look at something else in isolation. Someone comes in with a shoulder problem. Do we just hone in on the shoulder? No, we look at what's the scapula doing, which is the shoulder blade. We look at how does the scapula fit into the thoracic spine. Is the thoracic spine upright? Is it hyperflexed or hyperkyphotic, affecting how the scapula, the shoulder blade, articulates on the rib cage? Those are things that we look at before we dive into the shoulder. And sometimes we look at all of those things in conjunction to fix someone. But very simply, functional movement is not looking at necessarily individual muscles, it's looking at movement patterns. Now, to fix a movement pattern, sometimes you got to get in and work on individual muscles, yes. But it's a different philosophy. It's a different way of looking at things. Now, physical therapy doesn't traditionally look at things like that. And I say that with a caveat. Physical therapists are some of the people that develop the functional movement science alongside with chiropractors and athletic trainers, etc. So it was a combination of specialties, but there's a lot of excellent physical therapists out there that help design these systems. The reality is, do most physical therapists practice functional movement this way in their practice? And the answer is no. I went to a functional movement seminar years ago, and I remember there was hundreds of people at the seminar, and there's probably like 3 chiropractors. Everyone else was a physical therapist or athletic trainer. One of the individuals there that I met, who was a physical therapist, who I stayed in contact with, became good friends with, he became an instructor of this group. He told me, he said, "Hey Todd, less than 1% of the people in this room are gonna practice any of this in their clinics." And I said, "Really? That's surprising. Why?" And he said, "Because they're not set up to do it. They really can't. It's not part of their model." And then he explained it from a physical therapist perspective that really opened my eyes and confirmed some of the things that I suspected or had heard over the years. What he said is, he said how it works is that most physical therapy clinics are referred patients from a doctor, from a surgeon, from a primary care physician, from someone else, and they're telling the physical therapist, this person has a shoulder diagnosis, work on their shoulder for 6 weeks, 12 visits, 8 weeks, whatever it is, and then be done with them. So now the physical therapist gets the prescription, they work on the shoulder, and anything they do outside of that, they're not paid for. They can't bill for. This is in most cases, according to what I know. Set me straight if I'm getting this wrong, if there's any physical therapists watching this. But my understanding, this is what I was told, is that they can't bill for it, they can't get paid for it, so they don't do it. They'd have to do it out of the kindness of their heart. They don't have the time to do it in the model of how they practice, so they're gonna focus on the shoulder instead of looking at all the root cause things that lead into the shoulder. It's a problem with our healthcare system, it's a problem with the insurance system, the reimbursement, all of that stuff is a problem. The nice thing about chiropractors is that we are considered in most states like a primary care physician, meaning we can prescribe what we're gonna do for the patient rehab exercise wise, and we're not held like a marionette on the end of strings telling us what to do. We can call the shots. We can say, here's what this patient needs. Here's why they need this. I'm gonna work on their spine. I'm gonna work on their scapula, their shoulder. I'm gonna restore movement. I'm gonna give them home rehab exercises. Now, sometimes patients have to pay for this on their own. Sometimes it's not covered on insurance. But I would say that most chiropractors, especially in our clinic and in our systems, we do such a phenomenal job educating our patients as to the importance as to why they need this, that they actually participate. Because that's a key thing, is that you could have the best systems in the world, and if you're watching this right now as a patient, so I'm speaking to you as a patient, if you go to a doctor and they have the best systems in the world, but you don't follow them, you don't want to do them, how good are your results going to really be? That's right, they're not going to be good at all, because you're not going to do what needs to be done. So that's the key here, is understanding that our patients are human beings that have feelings and emotions and motivation and inspiration, and all those things need to be touched on. And that's why in our system, you see I'm wearing this black band. This is a black belt. We have a belt system of functional movement. It's one of the many ways that we engage our patients to go through care and strive for achievement, ascending up the ladder, getting better results, striving for that next level, right? It says on here, results matter most, which is our tagline here in the clinic. And that's really what we're about, is results. It's not about just having a cookie cutter model. It's not about just pain relief. It's about getting to the root cause of the problem and providing long-term lasting results. So now, when would you use a physical therapist? We use physical therapists. I have a couple that I know really well here in town, that when we have someone that's post-surgical, they just had a surgery, they need lots of one-on-one care. They maybe need something called like dry needling, which here in Idaho, we don't do that in the chiropractic clinic. It's almost like a type of acupuncture type of stuff that helps with affecting the muscle component of the joint muscle brain of why someone can't move well. Certain cases, that's very effective. There's just different models of care that they can do concurrently with chiropractic care. Now, I've said this in other videos before, but for the most part across the board, I don't like necessarily just randomly sending patients out to physical therapists, because oftentimes if we don't know the physical therapist and then they don't know us, they don't understand that we know more than the average chiropractor, and that there's a lot more we have in common as far as our philosophy and our know-how, but it's the things that go beyond that that are so crucial and important for the patient care. And if that physical therapist doesn't know that, then oftentimes the patient is getting two cooks in the kitchen. They're getting opposing information. Now the patient's stuck in the middle, and they're having to decide who to go to, who to follow, instead of it being a teamwork approach. So I'm not saying it can't work, because we have it work with a couple of providers here in the area, but across the board, this just pushes back to my case for and my push for why chiropractors should be addressing functional movement, corrective exercise in office, because that's probably going to address about 90% of the stuff you see out there with most of your patients. The other 10% or so that maybe takes more super one-on-one PT type of environment, we refer them to a physical therapist to work with us concurrently. But again, the vast majority, they do really, really well with what we're doing in-house. So I hope that this video, hopefully brief, I was trying to make it brief, hopefully this helps explain what the role is for physical therapy in this segment posture movement chiropractic overview that we do here at Gonstead, that we teach in MoveNow University. And hopefully this just gives you some more clarity on that. And then the last thing that I'll say is, just to clarify for the public, Gonstead Chiropractic is the segmental part. It's the adjustment. The posture is another technique. The movement is another system that we put together. The Gonstead part is how we adjust the spine. Our clinic is called Gonstead Spine and Wellness. But I want to be crystal clear on that, so that if you watch our videos and you see this, and then you go look up a Gonstead chiropractor and you expect them to have all the same philosophies and understand everything the same and have the same type of curve correction and posture restoration and functional movement department, I want you to be prepared so that you're not disappointed if that's what you're looking for. If you want a great segmental adjustment, that's the Gonstead work. The posture stuff is chiropractic biophysics. The functional movement is MoveNow University. We happen to do all three of those in one clinic, which, not to pat myself on the back or toot our own horn, but I think that's what makes us pretty great. So anyway, with that said, we'll cut it there. When it comes to the health of you and your family, like it says right here, results matter most.